Dr. Calvin has joined me on the set this morning. We'll be talking about pneumonia. All right, I'm going to find out, what causes pneumonia. How do you you are living your life quietly and nicely, and then suddenly you're not feeling well, and they tell you have pneumonia from their where, and so if you have any questions for Dr. Calvin, kindly use the hashtag Breakfast Daily for us to know what you're thinking. The WhatsApp line again is 0204-447-033. Dr. Calvin is the head of occupational health and wellness at Claron Health International. Dr. Calvin.
David.
Occupational wealth.
Yeah, I mean, because health is wealth, really. I mean, what's the point of all the money if you can't spend
right?
it? Yeah, so yeah, I like that one. I should probably...
Occupational wealth.
Yeah.
Yeah, but pneumonia, so is it a bacteria? Is it a virus? Is it a parasite of some sort? What are we talking about here?
I think pneumonia is one of the scariest disease names out there, because I mean, when people hear the name, it's like it sends shockwaves down their spine.
It does.
Yeah, and people have been sleeping in heat because they want to avoid pneumonia from air conditioning. So it's a bit scary. There's a lot of misconceptions out there, but it is a serious condition. Let me start off by saying that it is indeed a serious condition. It's an infection or inflammation of your lungs.
Okay.
And we all know how important the lungs are. I mean, when God created Adam, he was just clay until he breathed the breath of life into him. And it went into the lungs and he became a living being. So if you cannot breathe or if your lungs are not functioning, it's a major problem. And so pneumonia is one of the diseases that affect the lungs. It's an infection that can be caused by everything and anything.
Wow.
So you mentioned bacteria, yes. It can be caused by fungi. It can be caused by viruses, including COVID-19.
Wow.
It can even be caused by It can be caused by inanimate things. So yes. I mean, so let's say you were eating. You're eating some gobe, and then you were also maybe watching a match, and then Ghana scored a fabulous goal, and you were going to celebrate, and the thing, you aspirated the gobe into your lungs. It can cause a pneumonia. Wow. Yes, chemicals can also cause pneumonia. So a lot of things can cause pneumonia.
So pneumonia, you said, is an inflammation or infection?
So it's an infection, and as a response to that infection is inflammation of the lung tissue.
Okay.
So it's a combination of the two. So infection would usually lead to the inflammation. And so other things apart from germs, like I mentioned, can also cause that inflammation. So chemicals, food. So yes, it's a big deal. It is a big deal, especially at the extremes of ages. In the children and then in the elderly. For most of us in the middle, we are able to sort of deal with it effectively by our immune system and the treatments available. But when you're in the extrees of age, your immune system is already weakened, or it's not developing for the babies and then for the elderly it's weakening. You have other issues that are competing for your immune system, and so at those times you tend to be more at risk of severe pneumonia. So a lot of children and elderly die. I mean, we hear it all the time. Even prominent people, like as you read the cause of death, you always find pneumonia hiding somewhere in the write-up. So it's a big deal.
Wow. So wait, today's not about immune system. I was going to ask you that. Why is it that when you need the immune system the most, that is when it is rather not, when you are older, that's when you need the immune system to be on point?
No, but you see, this question, I mean, at some point you have to die, you have to exit, you see, and so things have to not work well for you to exit. So as you're growing older, because the immune system has served you it has served you so well, it has defended you. Look at the number of times you had got malaria. Do you know how many people actually have malaria that they are not even aware, because the immune system is actually actively fighting against the bacteria, so it doesn't actually put you down. So the immune system actually does what it's supposed to do, and unfortunately many of us we don't take care of our immune system, so by the time we need it, it's probably broken down. Of course, there are also diseases that tackle the immune system. Typical example is HIV. HIV actually affects the very cells. Yes, the very cells that are supposed to defend you. That's where HIV operates. So people who have HIV tend to have an even higher risk of getting pneumonia. A particular type of pneumonia called pneumocystis jirovecii. The name is, but pneumocystis. Once you mention pneumocystis, we all know that it's linked heavily to HIV. You know, so it's one of the classic. In fact, sometimes it is as a result of this particular pneumonia that we get to find out that you have HIV and you were probably not aware, not treating it well. Okay. You know, so it's a classic HIV presentation.
Okay. So when we talk about pneumonia, you've given us the causes or the possible causes of them. How does it manifest? What are the symptoms? How would you know somebody has pneumonia? How can somebody at home suspect that this might be pneumonia? Let me rush to the hospital quickly.
So typically, you will not be able to tell, or you will not be able to suspect that you have pneumonia.
What are we looking at here? What are we seeing?
This is an image of the lungs. I mean, so you see the windpipe or the trachea. That's when you breathe in, the air goes into the trachea, and then it divides into the bronchi.
Into the different
the bronchi, and then it goes into the left and the right, and you see the various networks. The bronchi develop into the bronchioles, and then eventually ends up at the alveoli. Exactly. The alveoli are the bunch of grapes that you see in the corner there. And what is showing at the bottom is what happens in pneumonia. So when we say inflammation, it means that in layman's term, water has entered the lungs. Okay. You know, because the cells have become a bit loose because of the infection, and so water is pooling in the alveoli. So that's what you typically see.
But if water is showing up in their lungs, then you can almost have a sense of drowning.
Well, I mean, it in a way, because that's why you struggle with breathing. So the commonest symptoms would be difficulty breathing, chest pain, cough. You know, so these are some of the common symptoms that you're going to find when you have pneumonia. Of course, there are other signs and symptoms that as doctors would elicit, but on your side as a patient, you'd have the cough, the fever, the weakness, general malaise, you know, headaches, you know, cough. It's very typical, and pain in the chest. Okay, it's also very.
So we are seeing here. The normal alveoli when the person is
fine.
Is fine, and then this is the one that is compromised.
Yes, so you see the fluids, and you have cells. You know, I mean, the white cells are also trying to get in there into the action. So there's a lot going on in the lungs when there's pneumonia.
Okay. All right.
So we don't want you to get this far. Yeah. You know. So that's why, I mean, ideally, if you feel unwell, you should come in for a routine checkup so that we pick some of these things early. Because if you left it, it can proceed and progress into you know, consolidation fibro. I mean, there's a long pathway. You know, and there are different kinds of pneumonias, you know, and pneumonias can be named according to so many different classifications. Where you got it from is one. So we have community-acquired pneumonia, where somebody starts coughing in the community, and then you pick it up, and you also join the train. So that's community-acquired. If you're going to get pneumonia, I prefer you got that one.
Okay. Oh, really?
Yes, because that's usually, you know, easy to handle. Okay. There's a second one, a more sinister one, which is hospital-acquired pneumonia. You know, and we don't usually like that one because those tend to be.
Why is that one particularly sinister? Yes,
because in the hospital, a lot of bad germs live in the hospital, and these are germs who know what's up. You know, they've been around the hospital for a while, so they know all the tricks the doctors are going to use. They know which antibiotics they're going to use, so they develop resistance against those antibiotics. You know, so they tend to be a bit more difficult to treat. You know, which is why typically we don't like people to come to hospital when they are not sick. Okay. You know, so when you go to, let's say, Kolebu, and somebody, your friend is sick, and the whole family troops in to go and visit, we don't actually like that, because what you are doing is you are putting yourself at risk of some of these things. You see, in as much as we try to keep the place as clean as possible, there are always these bacteria who are picking things, because let's say you're opening a vial of, let's say, antibiotic, it's going to spill. The bacteria, okay, so this is what they are planning on using against me, so let me begin to develop the resistance. You see. So the hospital-acquired pneumonia tends to be a bit more aggressive, a bit more difficult to treat, and so you require higher levels of higher versions of antibiotics. You know, I'm sure you've heard about MRSA. Yes. That's actually a typical hospital-acquired germ, and it causes pneumonia, and it's quite difficult to treat. So we don't want that at all. Then we also have the atypical pneumonias. We call them atypical because whereas I mentioned the cough and the pain and all the other symptoms, these atypicals usually have a completely different kind of symptoms. Like you will not even suspect pneumonia until you've done an X-ray or something, because they come with, I mean, unrelated. Somebody might come with, let's say, I feel weak. And then, you know, okay, based on the history, let's do a chest X-ray. You do a chest X-ray and you realize that, wow, there's something going on here. You know, then there are the viral pneumonias. I mean, they are not too common, but they do happen. Like I mentioned, COVID-19 is a typical virus now that can cause a pneumonia, so that's also there. The fungal pneumonias are not too common, but if you live especially in a place where it tends to be damp, or you haven't treated your ceiling, for instance, the material in there, it keeps giving, because fungi love damp areas.
Okay.
So you are sleeping in a bed, and it happens sometimes after flooding. If there's flooding and you don't dry your items, especially your beddings well, and you are using them, the mold, it gets into your system, and if your immune system is slightly compromised, it can establish an infection and then cause problems.
Okay.
So these are some of the things, and also by their location. So we can have pneumonia that affects the lung entirely. So and then that's called bronchopneumonia. So the entire lung field. If you do an X-ray, everywhere is white. That's bronchopneumonia. Obviously, by the sound of it, it's quite serious. Then there's lobar pneumonia, where the pneumonia is limited to a certain zone of the lungs. So these are all ways, different kinds of pneumonia that we have. Some germs cause particular kinds of pneumonia. So let's say if I see a picture of a certain kind of pneumonia, I can give me an idea of what exactly I'm dealing with, which can enable me plan the proper treatment for that particular thing. But ideally, we should do a blood culture, for instance, to identify which particular bacteria or germ usually it's bacteria, so which particular bacteria are we dealing with. Of course, there's also our good old TB. So TB is an interesting germ. It's kind of a bacteria, it's kind of on its own. So we always treat TB separately, which is why we have a whole chest clinic purposely for TB. Because TB will sitting there for months and be inactive, and then suddenly to start acting up. So TB tends to be another of the sinister causes, which is why the treatment is also quite long term. It can take 6 months to a year to treat TB, and especially if the person is not consistent, that causes problems. Because the resistance, they also get resistance very easily. So if you are on treatment for TB, there's close monitoring. People will actually come to your house and observe you taking a medication. That's how serious TB is. Wow. We don't want we don't take chances with TB. So people actually come and visit you and observe you taking the medication, or you go and sit in front of your pastor or an elder. Somebody must sign that you have taken the medication. Wow. That's how serious we take TB treatment. Wow. So if anybody's on TB treatment, please do not play with it at all.
What's the protocol if somebody has pneumonia? What would you start them with? How would you proceed to?
So first of all, it depends on the age. I mentioned the extremes of age, because if the person is young, they might require admission. If the disease is severe, they might require IV medication, because especially for children, if the child is coughing or is having difficulty breathing, we don't even feed that child, because there's a risk of aspiration, which would now complicate the already complicated situation. So some pneumonias are treated strictly as an inpatient until some of the symptoms resolve, and then they can be they can be allowed to go home. If the person is, our age, young adults, and the infection is not too severe, they can take oral medications at home. Typically, it's antibiotics, but you see, it doesn't also mean that you just walk into a pharmacy and buy antibiotics. This habit of us, we need to stop. We have to stop, because it's causing more harm than good. A lot of our antibiotics are now ineffective because people are abusing it. First of all, you're taking the wrong antibiotics, number one, and you're not even completing your treatment. Yeah. And so it's promoting the development of resistance, because if you don't complete the treatment, the antibiotic is alerted that this medication is also available. So you see, the rate of division or the rate of reproduction of the antibiotic of the bacteria makes them easily resistant. They can develop resistance to various treatment options as they develop themselves. Yeah. So we don't want to entertain that at all. So please make sure you complete your treatment. In fact, there's no excuse. Please make sure you complete your treatment. That's all. So antibiotics is typically the first line of action for pneumonias. And then of course we need to also manage our environment. Because if you are coming to me with repeated pneumonias, we need to find out, is there a predisposition? Are you asthmatic? Because asthma also tends to cause secretions to stay in the lungs. So we need to help clear that so that the body can deal with it. And then there's one thing that parents do that's not good. Pediatricians do not like cough mixtures and cough medications, because some of them will remove the urge to cough. Coughing is a reflex that is there to serve a purpose.
Okay.
When you inhale something that the body does not like or the body does not want, coughing, yes, would remove that item or that bacteria. So when you give medication to suppress the cough, you cause the bacteria to stay there, and then the likelihood of establishing an infection increases. Yeah. So coughing is a reflex, and so we must allow it to, to take its course. If the coughing is excessive, that's when we come in. But a lot of parents, when the child starts coughing, then they get medication to stop the cough, and that's not a good habit. We need to really get that under control. I mean, I wish the pharmacies and the pharmacists would help, but of course they also want to make money. So yeah.
Typically, how long does pneumonia treatment last?
Not long. I mean, a typical pneumonia treatment will be like 1 week.
Oh, really?
It's not usually does not take. Yes, it's not that long. And that 1 week, like I said, a portion of if admission is required, a portion of it might be spent on admission, and a portion of it might be spent at home. If the disease is significantly severe, then you might need an extended treatment, or sometimes there's a treatment failure, in which case you have to change the treatment and you might stay in the hospital longer. But typically 1 week treatment is good enough.
Okay, fantastic. Thank you. How do people get in touch with you if they want to find out more?
I'm active on social media, Kelvin Owusu MD, so you can find me on all channels. And you can also reach out to our clinic, Claron Health International, and we will definitely be of assistance.
Fantastic.